I use a data point to try to create perspective. I have two girls, and so we talk a lot about perspective all of the time. So the average adult in the United States only spends about 63 minutes. So an hour and 3 minutes in an outpatient setting to a clinic with a physician, a nurse practitioner, or a PA in any given year on average, which means they spend over 525,000 minutes outside of that person's care. It's crazy. And for us in the provider world and the health plan world, who is relying on that data and those diagnoses and those codes right from those providers, for us to believe that we're going to be able to treat, manage, and support people only knowing that small amount seems unlikely, is maybe the kindest way to put it. So it's socially determined. We're in the business of quantifying, clarifying, visualizing social risk. So first of all, I'll talk about the data that we use to be able to do that and what does that actually mean. We use a combination of 40 different sources of open public data from the American Community Survey and the USDA and the CDC. And we take that data, we combine it, integrate it with data about businesses or places. We want to understand access. So we think about healthcare access. How close are pharmacies or primary care offices or hospitals to a person? We think about food access, full service grocery stores, fast food restaurants, convenience stores that take SNAP benefits as an example. We measure distance and time to those places. And so we really understand what do people have around them. Thirdly, and probably most importantly, we consume financial and consumer data on about 265 million adults across the United States. So do you own the house that you're in? Do you own a car as part of that? How many people live in the house with you? What language do people speak? Estimated household income as an example. And we take those thousands upon thousands of data points, and we have created algorithms and models to quantify food insecurity, housing instability, financial strain, health literacy barriers, and transportation risks as part of that. So when we start to think about this 525,000 minutes, it's our job to quantify that. Naively, we believe that if we first provided that information, those insights, it's roughly, we turn it down to about 45 data elements and create a person level profile. That just those insights enough would be enough. And what we've realized is we needed to take, frankly, 2 or 3 steps more. And so we integrate our data with healthcare data. So disease, cost, utilization, claims level data as part of that. And then that way I can start to see those individuals who maybe have a disease like diabetes, but also have transportation barriers and therefore aren't going to be able to get to the doctor and maybe not be able to get to the pharmacy. We can help solve those challenges, or the plans that we work with, or providers that we work to be able to do that. And that's also allowed us to build a really great network of peer vendors who solve those challenges around social isolation, food, housing, transportation, et cetera.